I'm here today with epidemiologist Bonny Specker from South Dakota State University, who is going to give us an update on what's been going on with COVID-19 in our state, locally, in the world, and in our nation. So Bonny, before we get started on that stuff, what do you have for us today for Epi 101?
Well, I wanted to just talk a little bit about what epidemiology is and maybe a little bit on how you become an epidemiologist and then what an epidemiologist does, especially this time with COVID. And I thought to start out with, it might be good to know what the origin of the word is, because a lot of people, when I tell them, well, I'm an epidemiologist, the first thing they want to do is show me a rash that they have, because they think it has to do, with the epidermis, but it's not that. It comes from three Greek words: epi, which means on or upon; demos, which means people; and logos, which means the study of. So it's, in quotes, the study of what befalls a population, which, what's happening to a population is what it refers to. It is the study of the distribution and determinants of health-related states or diseases in specified populations, and then how to apply this study to the control of health problems. And I have a link here that is to a CDC website that gives you more information on what exactly epidemiology is. So how do you become an epidemiologist? Most people either have a master's of public health or their PhD in epidemiology. It is a graduate program, so you can't get an undergraduate degree in it. Usually you have an undergraduate degree in some other related field, and then you go on to graduate school and either get an MPH or an MS, a Master's of Science, and then you can go on to get either a PhD or a doctorate of public health. I personally got my degree, I have both a master's and a PhD in epidemiology from the University of Cincinnati Medical Center. So it wasn't a school of public health. I have an MS and a PhD, not an MPH. And the difference is kind of slight. Getting it from a college of medicine, we did things that were a little bit different than what a lot of MPH people do. Like MPH people might work for a Department of Health and they might be there to evaluate programs, things like that. Whereas getting it from a college of medicine, it was more methodological. Like I had a lot more statistics probably than some students that are getting in, say, an MPH or a doctorate of public health. They have more classes in administration, whereas I took a lot more classes in the sciences. One of the neat things about epidemiology is people can come into it from a big variety of backgrounds. So my background as an undergraduate was a biology degree. My husband, who actually teaches epidemiology up at SDSU and worked for the CDC for NIOSH when we lived in Cincinnati, he actually has his PhD in toxicology, the study of poisons. So he uses his background when looking at epidemiology. You have people from anthropology, genetics, a whole range of backgrounds that go into epidemiology. And in graduate school, what you're taught is really a lot of the methods that are used to study the distribution of diseases in populations. So you have a lot of statistics because you have to look at populations or numbers. And then you might have courses in infectious disease epidemiology, chronic disease, where you're looking at what causes heart disease, what causes cancer, how do you prevent those things? The smoking and lung cancer, that was determined by epidemiologists, that connection. So it's a wide variety of backgrounds looking at a wide variety of diseases. My PhD work was actually as a nutritional epidemiologist and in pediatrics. So I did a lot with vitamin D and calcium metabolism during infancy and with breastfeeding, what happens to a mother's bones, those sorts of things. So I would design studies that could answer those questions. I worked in neonatology, which, newborn infants, they run the NICU, the neonatal intensive care unit. And I used to get really nervous being around preterm infants. So I decided that the best thing for me to do was to figure out what happens with a healthy full-term infant. Because if you didn't know that, how could you figure out what happens with a preterm infant? So I looked at growth and factors that influence normal growth, and then took that information and applied it to preterm infants to try to figure out what the issue was with like growth failure, or how do you feed preterm infants to have them grow appropriately. For about the last 7 years, I've been involved with the Department of Health and Maternal Child Health Epidemiology. And that came about actually from our involvement with the National Children's Study, which was a large epidemiological study that included Brookings County. And so that's kind of how things have evolved over time. So why is epidemiology important for COVID? Well, I've just listed some things here that epidemiologists try to work on, or what they can be doing. One of the big things is identifying the source of outbreaks for, say, infectious diseases. So the epidemiologists in China were some of the first people to identify that food market as the source of COVID. There's also, in epidemiology, we learn ways to measure how severe an outbreak is. We know morbidity and mortality data. How do you look at that? What are the sources of that data? What are the statistical methods that you can use to look at it? And one of the goals is to define risk factors or identify at-risk populations so that you can then intervene by either minimizing those risk factors or making sure that the at-risk populations are protected somehow. Another thing that epidemiologists do is monitor trends over time. So that's the daily report that I do for COVID. We're looking at what's happening over time. There's also some fairly elaborate statistical methods that you can look at to monitor those trends. Epidemiologists can be involved in developing guidance on ways to slow down the spread of the disease. One of the studies that was looking at aerosol was done in they noticed that these cases, that there were several cases coming from this one restaurant. So an epidemiologist may have investigated that and figured out how they were connected. It's kind of like solving a mystery, but the mystery involves human health. So that's why I have always liked it. I like mysteries. Also, one thing that usually, like you might have PhD epidemiologists as part of a team that might work on designing and monitoring clinical trials. So that look at drug efficacy and also the testing of vaccines. I've been involved in several clinical trials related to nutritional interventions, as well as treatments for bone-related diseases, since I've done a lot with bone health. And also, epidemiologists are often involved in what's called data safety monitoring boards, which is a committee that reviews data on, say, vaccine efficacy or drug efficacy. They're the ones that in recent weeks have like said, asked the vaccine trials to stop temporarily because they review safety data on vaccines at regular intervals. And they're part of a team, you know, there's a lot of people on those committees, but they're pretty interesting to follow. And that's what an epidemiologist does. I like it. It's, you know, it sort of is a nice mix of things. You can be at the computer working on data, but then at the same time, you're out meeting with people and trying to figure out or collect data to figure out answers to specific questions.